There's a moment in every physician's life when the story shifts. Welcome to Unscripted, a physician's journey, a heart-centered series of candid conversations exploring the moments that shape and reshape who we are. It's a space for human conversations about the lives you lead behind the white coat. In each episode, you'll meet a physician who's reached a crossroads and found the courage to listen, change, or realign. I'm Lisa Catalano, a clinical social worker and certified midlife transitions and well-being coach for physicians, and I'm honored to welcome you to this conversation. Today, I have the profound privilege of sitting down with Dr. Sandeep Sahay, a world-renowned pulmonary hypertension specialist and prolific researcher based in Houston, Texas. But that's just what he does. It is absolutely not who he is. He's a father and a husband, and his mission is to teach his daughter some really meaningful things in life. He has shared that he has been so engrossed in the cocoon that medicine creates, he is anxious to live life beyond being a doctor. The pandemic gave him a new perspective, one which he will share with us today. My hope is that as you listen to this conversation, you'll feel a little less alone and maybe a little more seen. We're not here for polish, we're here for truth. So pull up a chair, grab a cup of coffee, and let's begin. Sandeep, thank you so much for being here with us today. I'm so grateful for you and for the time you're giving us.
Well, thanks, Lisa. Thanks for having me, and thanks for your kind introduction. I'm really looking forward to talking to you today, and I hope I could provide some perspective to some of my peers who I work with, who I meet, talk every day. So, thank you for this platform, and thank you for this opportunity.
It's such a privilege, and I think I can share that we've had the opportunity to have some conversations together, and so I'm really looking forward to sharing your story. I think it's a beautiful one, and I think it's one that's going to really resonate for folks. So maybe we could just start at the beginning. My favorite first question is, what was the moment you decided being a doctor is a good idea?
Well, thank you for that question, although it's one of the tough one to answer. It's actually growing up, I guess, as I don't need to emphasize that I come from India, and it's just growing up. I think it's always a little crazy. It's kind of funny that I just wanted to have like doctor with my name. So that it's actually started like that, and then as you may have seen in the U.S., many doctors which are Indians and engineers. That's kind of like a traditional path that you just grow into it, and that's what it was. And then one of my family friends' son was in med school, who was older than me, and kind of when I was in school, and he used to talk about, show us things and anatomy classes, which it was kind of fascinating stuff. That, and I think that's how I got attracted to that. That okay. So I actually never thought of doing anything else but being a doctor. Although in medicine, once you get into med school and you decide what branch you would like to choose or decide, I initially thought that I would want to be a surgeon. I guess everyone gets influenced by surgeons a lot just because of the personality, the kind of work they do, and but then I think as I evolved into into med school, just became more sort of decided towards doing medicine. So, yeah.
What was medical school like for you?
It was fun. It was really fun. I was young. It's kind of different in the med school is longer in India than the U.S. med school, the duration, and you started right after your high school, so it's kind of you're a little bit immature. But then you do a longer med school. So by the time you graduate, you're kind of similar age as in the US. It's almost 5.5, 6 years med school. And then, but it was interesting time. You make friends, and trust me, even today I have, those are my, one of the closest friend, like who you pick a phone and you can just start from where you left off, those kind of friends. So,
it's funny, that's been the consistent answer for everyone that I've asked that question of, that medical school was this bubble, this, it was a joyful.
exactly. It's bubble, and I think you don't realize the kind of training, the strenuous training and the long hours. It doesn't stress you. I now when I look back, I still remember days when you're sleeping at like 3 or 4 a.m. in the morning and wake up at 6 or 7, and you're attending your first lecture in morning, totally fresh. And now I need like my 10 hours sleep. I can 8 to 10 hour. I can't function if I don't sleep. So it's very different. And I think those foundational years are really important.
Was, given that it was a lot of cultural drive that really prompted you
Yeah.
to become a doctor, did it live up to what it was supposed to be for you those years in medical school?
I think so. I think so. I mean, the most interesting part of my med school journey or career or life has been that I never thought that I wanted to come to the US. Never. I never. I didn't even know where Houston is, where Boston is when I got into med school. Never thought. I did my med school, my residency, fellowship, everything. And then actually it was my first job, and I met my wife in my residency back in India. We both were pulmonologists there, and then and we both got jobs. And then in those, like, I think my wife probably did not feel that much, but I used to go to my job and just not enjoying it. Just I can't explain in words, but I was just not satisfied. And when everyone asks me like what's not satisfying, I can't describe it very clearly. Like, no, something is just not right. It's just not feeling right. And so then that's when, after completing all those stages, I was 29,
Mm-hmm.
already completed my residency fellowship, which was another 5 years after med school.
Yeah.
So then I decided like, okay, I think I need to go. And I never thought that I want to go to US. I thought I just want some more training, maybe some developed world. So I actually thought of going to Australia, New Zealand, UK, wherever else,
Mm-hmm.
because US was always one of the tough ones because you have to take the USMLE exams and all that. So I thought taking those 3 level exams will be too much for me, and I guess just go to Australia where you could do 1 year of, just work experience and then come back to India. That was the whole plan. And when I started looking into those options, everyone, they wanted some kind of equivalent entrance exam sort of thing. So but everyone used to accept, like, all these countries, developed world was accepting the USMLE exams. So then I thought, like, if I have to take the exam, then why not just go to the US? I was in the same city as my parents, and first of all, I could not explain my mom, and she was like, "What? Why are you? Where are you going? And what are you doing?" And I think it took her a long time to really accept the fact that I'm leaving country for good. Uh, and the challenge was working long hours. I used to do 36-hour shifts in ICU. I was pulmonary critical care. And doing those shifts, so whenever I get my off, next day off, I'm so tired to study for the exams. And if I leave the work and study for the exams, then I don't have money to pay for for the exams, and Indian rupees, and then you have to pay the fees in dollars, so it's like expensive. Exams were expensive, and then we're doing for two people, me and my wife. So we took exam, we passed the exams. I had a lot of funny stories during that time. First trip to the US was so I have so many funny stories about that. And that was me and my wife's first trip to the US. Land in Houston, and we stayed in Days Inn. That was the cheapest hotel
Yeah.
kind of you could get. So I stayed there, and were born. This is the first. No, I had gone to do a scientific presentation to Korea once, so this was my second time leaving country, and first time to the U.S.
Wow.
And so, was born and raised as Hindus. We don't eat beef
Mhm.
culturally and religiously. So,
And you're in
uh,
Texas.
and I was in Texas. That's my first time like landing here in Texas,
Okay,
and
welcome.
here like everything is like it just goes without saying.
Yep.
And I mean, I eat chicken, fish, egg, and all, but pork. But I can do beef. I can't not. I mean, at that time, when you are first time living out of your cultural thing, it just felt like such a big thing. So we we landed here, and me and my wife, we were just cramming and studying. We had exam like in 2 3 days, uh, and we were in these days in, and I told my wife like, let's go uh, to some place and get some food. So we go out and we see this McDonald's, and we were like, oh, that's McDonald's, because we have McDonald's everywhere, even in India. So we're like, okay, that's like a safe place. We can go and have whatever food. And so I go to McDonald's, and I'm just looking at the menu over there, and and I see cheeseburger, and and this is my first time ever, and I thought like cheeseburger is cheese, like it's cheese. It's probably vegetarian. It's like a cheeseburger, and I go and I to go to the counter. I said like, okay, well, we're prepared. And in my mind, I'm like, okay, I don't want to come back and waste my time. So because I'm studying for the exam, so just so so two for lunch, two for dinner, like 4 or 5 cheeseburgers, and we warm it up, and I take my first bite, and I'm like, that's pretty chewy, like it's like a meat, and this doesn't feel right. And I look at the wrapper of the burger, it says 100% beef. And then I'm like, and my wife was about to eat, and I'm like, okay, stop. And then I tell her, and I'm like, damn it, and I spit it out. I'm like, and I felt so bad. And I'm like, and I'm cursing myself, like, why did I decide to come to the US? Why I want to go? Why did I move? And it's just, emotions and feelings at that time. So, and then and we are hungry and we have exam and we're stressed, and so I decided, let's get some pizzas. That will be the safe. Eventually, we ordered a pizza and then we had food. So it was just funny stories at that time. And then we took exam, we passed, and then we decided, we finally moved to the U.S. Uh, and that's when our life actually changed, and we had our firstborn child. We both were residents, and unfortunately, he had birth complications, hypoxic brain injury. So he was a child with cerebral palsy who was nonverbal, disabled, but he taught us a lot many things about life. And unfortunately, we lost him last year in September. It's coming to be a year. This upcoming September will be a year. But I miss him every day. He he was he taught us so many things about life: fight, risk taking, love, emotions, everything. I think he made me a better human being, probably for the rest of my life. Life was a struggle with him, but at least life was struggle for him. I hope if there is life after death, maybe I'll see him again at some point in time, and I miss him. So, so the journey in the U.S. has been very interesting, but I'm very grateful. I love every moment of being here, and people have been wonderful. God, no matter what politics say, we had a Lebanese woman who really helped us out with our, because we both were residents, and with our son, because he could not go to the regular daycares and all, and we didn't have any family here, so it was a little challenge for us to. And in residency you do 80 hours a week, so we always made sure, and our residency program was very nice and people were very supportive, knowing our special circumstances, that they always made sure that we both are not on the call at the same time. We were in the same residency program. And then we had this friend of ours who was our chief resident from Jordan, and he had this friend who was Lebanese woman who had her three kids, and she used to take care of our son, and she loved him. She really loved him, and she used to pick him up from our home in morning and then drop. We used to pick him up from her place in evening when we used to, get done from work. Uh, uh, and she used to take him around all day, like because her kids used to go to school, because our son used to not go to school, so she used to take him everywhere wherever she's going. So like to her gym, and he used to spend a lot of time with her. And I still remember one day she came to us and she said, uh, I ran into these two women and they wanted to speak to you. And initially I just ignored, and I was like, I don't know. She gave me the number and like they wanted you to call them, and I was like, I don't know who they are and why they want to speak, so I didn't pay attention. Then I think a couple of weeks later she again said, like, these women came to me and they wanted to, speak with you. So still remember two women, probably in their 60s, or they come, they look at our home, they look at our son, and our son had very beautiful eyelashes. Everyone used to always compliment him for that, and he had a beautiful smile also. And I'm not saying it just because he's my son, but he did have a beautiful smile. And they said the same thing, like he has beautiful eyelashes and he has beautiful smile. And me and my wife were like, thank you. And then one of them takes out this credit card and puts it on the table and said, we want you to buy whatever you want for him. I mean, I'm just uncomfortable with this because I don't know you. Second, we never asked anyone anything that, and I think we are pretty capable of providing him whatever we feel. She said, no, don't take this wrong, that it's not that you're not capable, but we just like him. We want to give something for him. I said, I appreciate that, but then first of all, I don't know anything about you, and I don't know you, and I don't know why you want to go. I, I mean, as it was very natural for me to have like a little bit, getting a little bit suspicious, like, is there
Or
any,
doubt. Yeah.
yeah, like what's the motive behind it, like why, and they said, we just like your son, and we see that he goes with Rola every day to, she brings him to gym, and we have seen him a couple of times, and he's such a beautiful child. And I said, I really appreciate your kind words, but I cannot take anything. I mean, that's just not. And then one of them said, like, well, I understand the hesitation, but we do a lot of fundraising. We both have, so they both had multiple sclerosis, those women. And they said, like, we do a lot of fundraising for multiple sclerosis women. And we do it for anyone who is in need. But I said, but I never expressed that I am in need. So they said, I know, but we just want to sort of like as a gift for your son. And then my wife was like, yeah, we need a bathing chair for him because he was getting bigger and it was hard. And then there was this physical therapy chair for him to learn to sit. And I was like, they're very expensive. And so I still remember we went to this used store, and then we bought a used one, like the cheapest, whatever we could buy. I don't know who they were. I don't know anything about them, but they just came and helped us at time when.
You know what I'm thinking back to all the things you've shared, and what a tremendous, first of all, what a tremendous sacrifice to become a doctor, both within your country and going through all those years of school, even though it was fun, right? And then making the decision for both you and your wife to come to this country, learn a whole new system, take a very difficult, expensive exam, learn a whole new culture, and also live in a,
in
state
a
that's,
in a strange
yeah.
country, no family members, culturally different, learning the culture. But I'm just saying that those days were challenging. Challenging. I mean, I think with our son, things got better. I moved to Texas, actually from Ohio. Although we loved people in Midwest, my wife still really loves Midwestern culture. We moved to Texas just because we wanted a little bit bigger city to provide better sort of support system for him. Just we didn't have enough resources in Ohio for him. Just
Mhm.
so we did our fellowships here in Texas, and then during this time, I somehow became interested in pulmonary hypertension, and then I kind of just devoted my whole clinical practice and research and interest in pulmonary hypertension. And as many of my friends and colleagues know, that for almost 10 years I've not practiced anything else than pulmonary hypertension. So I'm just into this now.
I mean, there's so much I want to ask you about. But first, what is your son's name? It's
His
important to
name was Sajal, Sajal.
it's important to honor him. And,
Yes.
I think I'm sure he taught you a lot, but I also know that your heart was your heart long before he came along. And so he was lucky to have you as a dad, no question about it. And
I think I would give more credit to my wife. She did pretty much similar fellowship as I did, and working physician, and as mom, she did a lot of sacrifices as mom and doing the best for him. I mean, he in last few years he used to not sleep well all night, like years together, waking up in night, and we didn't have anyone in the night. So
yeah.
you're working in for your daytime and then waking up night. He never had a sleep cycle, and as he was growing older, then last few years he was persistently every day having seizures, and I was becoming much busy in my pulmonary hypertension world, just kind of building my own name, career. So I was becoming much busier, traveling a lot, and so it kind of I felt guilt somewhere. I could see the stress, but I just could not find a balance. Where is that balance? There was a clinical work which is never getting less or stopped, or and then there is this dad side of me which is finding it very challenging, and then there is this professional accomplishments, career, investment. The thing is that if you do not invest into that, then I started feeling that why I'm doing this if I'm not doing. If the point is either you go into something wholeheartedly or you just don't do it. I mean, and
Mhm.
there were moments like that
Right.
where I decided like, okay, well, I don't want to do this, or I like the decision not to practice critical care. I was certified, and I decided I'm gonna stop it. That was kind of a little hard because I did critical care for a long time, and then I decided, and then even in pulmonary medicine, I decided just to focus on pulmonary hypertension, which was kind of a little bit gamble. You're going in a very niche area, and if it doesn't work out, luckily I got a mentor who had an established program. She took me under her fold. I felt disappointed that she retired within 2 years when I started. But then I took that as an opportunity. So one thing which I always feel, if you want to be successful, you have to take risks. I mean, no matter what, whether it's your career or you need to learn to take that risk somewhere. If you play safe all the time, you may be successful, but perhaps not to that extent where you should be or where your potential is. If you want to explore your full potential, then you need to take some risks. And I think that was my risk at that time. And then, of course, challenges in his life was in parallel, which was very stressful at times. He had multiple hospitalizations. He was G-tube fed. We never had good, stable nursing support. I mean, it was ups and downs with him all the time. Last year was rough. I still remember one of my senior colleague. Two times I went to European Respiratory Society meeting, and I had to cut short my conference and come back soon because he got sick. It happened 2 3 years ago. Then it happened last year also, and then both the times, unfortunately, last year one of my colleague mentioned, didn't it happen last year also? I'm like, yeah, I don't know if this meeting is jinx for me or every time I leave the country to come and he gets sick. So, and my wife is alone and I need to go back. And this time he just didn't recover. Right after the meeting, he passed. Um, I think it was writing on the wall in last 1 year. I would say me and my wife kind of had a sense. I think my wife was more courageous to face it. I was behaving more like an ostrich, putting my head in the sand. I didn't want to face, but I have to face it. It's not easy, but
Sandeep, what I always say is that people do things at a pace and at a time that they feel ready to. And, we can't rush grief, we can't force it. And I think you did the very best you could under the circumstances. And I think it also takes a ton of courage to be able to look back and say, there might have been things that I would have done differently, but it's what I was able to do then. And that's okay. Right.
yeah,
Um, and I also say that there's a tremendous amount of it's risks that you take also, but then there's the complement to that is the courage and the bravery to show up every single day and do your job with commitment when your own
yeah,
heart is breaking, right? And your
yeah,
wife doing the same, and I can't even imagine. Um,
yeah.
what that time was like, what it's like for you now too, because that doesn't go away,
It
right? That
doesn't go away. I think it doesn't go away. I mean, even in when as I walk into our bedroom, we have his picture on the wall, and I every day see it. It's right there, and I feel like I just don't have courage to just make an eye contact with that picture. I have honestly haven't had courage to walk back into his room in last 1 year. I've probably not spent. I mean, I may be with someone else when they are there, like my wife is there, maybe 5 minutes with her or 10. But alone, I have not had courage to go in because I have had my own moments breaking down, and I just can't. It's hard. It's hard. And then before this, I had my own aortic aneurysm surgery, which was literally 8 10 months before that, and I was still recovering from that. Recovering it means that just kind of physically big surgery. You just kind of, and that was also totally unexpected. And my wife always says that he was waiting for you to get this done before he left us.
yeah.
Yeah, because he was not doing well, and we knew. And then I got diagnosed with this, which was very random. I was running in like evening jog, and I just started hearing some weird sound. I can't explain what it was, and next day I called my colleague cardiologist, like, hey, just something kind of weird sound I am hearing, and he said, well, why don't you come? Let's do an echo. And he did an echo, and there you go. It's like 5.34 centimeter ascending aortic aneurysm, and I freaked out. And anyway, I mean, I talked to many surgeons, got multiple opinions, and finally decided to get it done at Cleveland Clinic. So we went to Cleveland Clinic, got it done there, and came back. Thankfully, everything went well, but it was just a different. And then we had to. My son was not doing well, and my wife was actually more worried that when I'm recovering, he should not decompensate. So it was a lot on her shoulders too at that time. And I'm such a control freak that I want everything under my control. And that was one moment when I'm rolling into the OR. I had like no control on anything, and so you just give up at that time. And I gave up, and I was like, well, I think I did everything. I came to the best place I could find on planet Earth. If anything happens, then it happens. It's beyond my control. So, lesson number two from this is that if you are in that situation, take as many opinions as you want. And challenge was, I had a disabled child, taking him to, like, the child who we cannot even drive 3 hours. We had to fly with him being on oxygen, G2 fed, and all that. And then when we are coming back, who knows in what shape I am going to be, or whether I'm going to be come back or not. It was a big surgery. It's not like
Yeah.
small thing. It's a major surgery, and thankfully things worked out. And but that's one thing I always live by. Never live in regret. So do your best, push hard. And that's just me. And I think this is again credit to our son who, for his life, we fought for him, we advocated for him, me and my wife, and so this is. I think he just changed me for, and I think, and that's what patients see in me. I think when I see my patients, they see that. I mean, if I have some disagreement with any of my colleague physicians or something, and out there for all my colleague physicians, I love you all, but I'm gonna just say that if I feel like that patient is not satisfied or not, I mean, I pick up phone and I talk to them, and if they don't feel, I easily tell them. I tell my patient, you don't like me, find another doctor. I tell them honestly, very honestly. I say, like, you don't like me, you don't agree with me, fair, it happens. It's totally normal. Like, find another doctor, but when you find, let me find you one who I feel is better than me. Might be that will be a doctor you need to go, and maybe it might work out for you. Because we all are humans, right? So we all are in a different state of mind. Like you just said earlier, that we did whatever best we could at that time for him. Maybe in tomorrow's time, I may be doing things differently. But it's sometimes when we go and see the doctor, we are in a different state of mind. We do not, whether we are accepting to that diagnosis or that treatment, whether we are not accepting, we're in a different state of mind. Our priorities are different. We're not ready to accept. So even if the doctor is saying the right thing, we're just not ready to accept what he or she is saying. So we decide, oh no, he's not a good doctor. Well, doctor probably is right, but maybe you're not ready for it today, which is fine. And maybe sometimes the delivery of the message also.
Yes.
And that's another thing, that how I conducted myself in that conversation and how I portrayed that thing. It may not sound right. Maybe the message essence was right, but probably delivery could have been better. And sometimes people need that. Sometimes people need more TLC. Some people are different. They want more
Direct.
sharp shooting kind of direct thing, like, just tell me what it is, I'll deal with it. So so I always say, when you are seeing patients, read the room when you're having the conversation. But one thing I have learned in patient care is communicate effectively. That's very important. Communicate effectively. Even if there is a disagreement, I I have had patients where they don't want to see me again. That's fine, and I don't have any hesitation in saying that because we are human and they are human too. But even in that situation, I had gone there and I have communicated to them effectively. That's totally fine. I respect that. But this is my suggestion that even if you don't want to see me, although it's very rare, like rarely it happens, but if that's the case, I suggest that you go and see this person or that person who might be able to help you.
So, John, it also, I always say that life is our greatest teacher, right?
Oh
So,
yes,
as we were talking about what you were ready for as Sajal's illness progressed, um, it's the
yeah,
best you can do, and now you've lost him, right? And so there's more that you've learned from that experience. You have the unique perspective as a physician of being a patient in critical care, right? Being a family member, a loved one, a parent of a sick child,
yeah,
and having to advocate for him when he didn't have a voice of his own, right?
yeah.
And then an expert in your field.
Oh yeah,
So it's like a triple threat in some ways, right?
yeah,
You can appreciate. I think there's something really unique about this because as you're talking about how you're communicating, you're informed, right? As a patient, you're informed as a caregiver, as a provider, and it really allows you then to really absorb the experience of the other. You can appreciate your patients in a way that many docs can't.
yeah. No, you're absolutely right. That's what I always say that my son taught me a lot many things, and you're right. This is also whenever I'm rounding with my team, I always say that I have seen in this healthcare. I've been to all of these places. Like I've been to all of these chairs on both sides of the table. I've sat into all. I've waited for doctor's appointment for 2 hours with him. So that's very normal. We have done that.
It's unpleasant, but it's normal.
Unpleasant, but it is normal. We have done that. I have ran from his appointments because my patients were waiting in clinic, so I have done that. It's one thing. One story I always say that I had a patient who had scleroderma PAH.
Mhm.
This was a long time ago, probably 10 years ago. Very sweet woman. She taught me one lesson of life which I could never forget. She said all her life she worked very hard. She saved all money in her life that when she will grow old or she will retire, then she'll travel the whole world. And then she developed scleroderma and then PAH and then ILD and all that. And then she was oxygen dependent and short of breath. And she says, now I cannot even walk from here to there. So I feel every day that what I'm gonna do with this money, and she used to joke with me and like, and now I'm spending all this money on you. I was very sad, and I asked her. I think I was rounding. That was a weekend or something. I said, oh, "What do you want? What like anything I can do for you now?" And yeah, why not get me a margarita? And I was like, oh, I was like, you know what? I'll do it. I'll do it for you. So I stepped out of the room. I called my nurses there, and I have a lovely team and nurses there, and they knew that how passionate I am about. Like, okay, we need to get her a margarita today. I mean, like, I
I
don't
love
care how. And well, so we then one of the nursing child like, I can't get alcohol, and I'm like, I know, but okay. So then I went and okay, can we do some like a virgin margarita or something? And she said, sure, whatever, but I want to have it. I'm like, okay. So then we prepared it for her, and we got her a margarita, and she like it just to make her happy. I
Yeah.
mean, it's just. She was just such a wonderful person. So, the one thing which I never forget that enjoy your life today. You never know what's going to happen tomorrow. So just live in today, what you have. Like I was talking to my a friend 2 3 days ago, and he was like, "Oh, you should do this investment, retirement money, and all that." I'm like, you know what? The kind of life I have lived so far, I don't even know what's going to happen tomorrow. So don't talk to me about retirement. And he said, "You have a kid, you should save money." I'm like, "No, what I want my daughter or my kids to learn to be independent, being a wonderful human being, and if they are, they will be able to sustain themselves. I'm not worried as long as they become a good human being. That's the most important thing, and I'm pretty sure they'll be able to sustain themselves, and that's the most important. So I want to live. So the lesson three is live your life in that moment. Make your today beautiful because you don't know what's in the future. That's my one thing. Another lesson which I learned from one of my mentors. She was a fast. I love her. I adore her. She was a well-known expert in this disease state. I learned from her a lot. Wonderful woman, but she was a tough personality. Like I
Mhm.
still remember when I started working with her, she she had a different aura. If she's walking in the hallway, you'll be like you she's someone like you will turn and look at her like, who is this person? I learned a lot about in medicine from her. I always joke with her now she's retired, and I was like, when I started with her, and two things which I was like, first, she didn't let me complete a sentence. She will be like, fast, fast, like speak up fast, like, okay, I don't have time,
Boy.
just move. And I'm like she doesn't even let me finish a sentence. And then second thing which I learned from her was that speak your mind. She never polished words, like she never will be sugarcoating words. Just speak your mind, whatever is in your mind, just say it. And then last lesson, when she was retiring, I think I was very nervous because I knew that I felt like she was like a coconut, hard from outside, but she was very soft. She's someone who you could trust. One must learn to identify those kind of people in your life, that who you could go back and talk, and they will stand next to you and support you. And she was one of those. And one thing she said that, Sandeep, I worked my life 30 years in this field. There are people who don't like me at all, and there are people who really like me. And I don't know if she remembers this or not, but I had this conversation in her office, and she said, You know, I don't care about those who don't like me.
Mm.
I really don't care. And, but I do care about those who like me. So I put my energy there who like me. Those who don't like me, that's fine. It's okay. Bottom line, what she was trying to tell me, in life, you will never be able to make everyone happy.
That's true.
So just stay true to yourself. Just be honest, be sincere. There will be people who will always be unhappy. Well, you may not be able to satisfy. I don't want to say the word politically correct, but we try very hard to keep everyone happy. Sometimes no matter, and in doing that, you do not remain true to yourself. So that's what she was trying to say, that you do what you have to do. It has.
Well, I think she's also, I mean, this is what I write about so often, is about living your authentic self, living your authentic life and being your authentic self. And in doing that, there are going to be people that maybe, that's just not their cup of tea, and that's
Yeah,
okay. But the people that you draw, the energy that you draw from that, you're going to have so much love around you, and you'll be happier as a human being and attract
yeah,
better things in your life, I think, also, right?
yeah.
You know, on that note, I kind of wonder if you were to look back at the young man who started medical school in India and all that lay ahead of him, and your life now and all the things you've lived through, what advice would you give that young man now?
Uh, I really enjoyed being a doctor, but I really feel like I want to live life not being a doctor. One
Mhm.
advice I would have given to myself, which I felt it after COVID pandemic. But once I was actually listening, we had an invited speaker actually from Boston, a cardiologist. I forgot his name. He's very popular. He's published a lot of work, and he came. Medicine just takes away everything else from us. It's just the need for this profession is that we just stay as doctors. We're not, nothing else. Then we're just doctors. Then we are four friends sitting, husband wife sitting. We're always talking about medicine. All conversations somewhere will end up in some kind of medicine thing related to medicine. We and what he said was, if you are becoming a doctor, get 1 degree in something which is not medicine.
Mm.
And he said that, he said, use your brain in something which is not medicine. Do whatever you want to do. I mean, whatever, but take 1 degree which is not in medicine. And I think that was such an important thing because it gives you a perspective of life about something which is not been. So what I want to do is I want to live few. I don't think I can do that, but I have a very strong desire to live my life not looking through the spectacle of a doctor. I want to see it as a non-doctor. How, and it's kind of, I don't know how I can detach my brain. It's very hard for me to do it, but I just want to see life from a total layman. You know, in medicine we use the term layman. Now, how you define that layman is that's how I want to. I mean, probably I'll be more risk taking or total layman doing stupid stuff, maybe. Doctors are just so engrossed into the profession gets onto you. Your
Yeah.
thought process, your thinking, it just gets onto you. So perhaps I want to spend some time not being a doctor. I don't know if that's possible or not, but that's something I would like to do.
Someday for sure you'll retire.
Yeah.
I hope. And
That's also difficult for doctors,
yeah.
you know?
But I think you're talking about, that as a palliative care social worker, I see people at the most vulnerable times in their life, and illness is just a part of my everyday. And I'll go on a trip somewhere and I'll see elderly people or young people just healthy and having fun and enjoying their life. And I'll think, oh yeah, things can be this way. It's not all death and dying. So I almost wonder if that isn't part of what you're saying is that, outside of healthcare, outside of medicine, people are shielded and they just don't see the same. What happened over there? That's exciting.
I,
They just don't see the same level of suffering, devastation, loss, grief,
yeah,
uncertainty, life and death stuff that we
you're
see.
right. Yeah, and that's probably was true in COVID because when we were going to the hospital, we were seeing death everywhere, and our
Death
perspective was
alone,
different. Yeah,
death alone, right? These
yeah,
people will be dying without anyone around them. So,
exactly.
yeah.
Yeah, and that which my family members were not seeing. So suddenly I'm realizing that how they're interpreting the same situation in a very different way, and I think because we see this so often every day. Like this morning, I had some tough conversation with a daughter about her mom, and that just changes your whole perspective. So, uh, and it sort of it's stressful on you also. I mean, especially when you are dealing with like my specialty, which is a fatal disease, you have to deal with. It does affect you at times. I mean, you walk out of a room and like, okay, I don't know, there is really nothing we can do. Just sad. So that's kind of like if you are dealing with in every patient, it's just sometimes it gets onto you subconsciously. So I think maybe that's what I want to do a little differently if I can. I don't know if
More
I
fun, more play, more freedom, right?
probably
More
yeah
passion focus.
yeah.
Sandeep, before I have to say that this has been such a rich conversation, and you have so many, I think, important lessons for us all to learn from your experience. I wonder, is there anything else that you think would be important for people to know, or that you?
Well, thank you for giving me this opportunity to really share. I mean, I can go on and on. There's a lot to talk on. It's just a little glimpse of things, uh, but I I don't know. Again, this was my life, and this has been like this throughout. Uh, Sort of struggle, fighting, trying to do your best, and I think that has become my nature. One day, I still remember this was last year, I think, in Europe. I was in a meeting, and then kind of like a ice breaking. I was with a bunch of global colleagues and from different countries, and they were like, "Okay, discuss your hobbies or whatever you love to do, and something like that, and something which is non-medicine." And when my turn came, and I was like, "I don't know. I honestly don't know what is my that thing." So I think in last 1 year, I've voluntarily trying to develop some hobbies or something different where I can detach myself. Yeah, I mean, but thank you for giving me the opportunity to share.
What a total privilege, and I'm so grateful to you for really your honesty, your vulnerability, the power behind you know that you faced so much adversity, and the power behind the message.
When adversities hit or situation is challenging and struggle, these are part of life, and they come in different shape, forms, name. It comes to everyone. I think I got strength looking at my son, and probably it became my nature now, whether it's for my patients, for myself, or for anyone. I just don't give up easily.
Mhm.
And I feel like in the end, it works out for you if you just keep fighting. So keep that spirit up. The other lesson I have learned that grass is greener where you water it. So it's not there where you are thinking. So make an effort, try to make changes. Sometimes we do hit roadblocks for sure, but at least give it a try. And it's actually true for everything, not only just job, it's your relationship, work, whatever. As parents, I mean, you need to make that effort to really make things work. And majority of time, I think they do work if you make a sincere effort. But sometimes we do, and that's okay. It's okay if it doesn't work out. That's also fine. It's not something end of the world, but at least give it a try, because in the end you don't want to live in regret. That's my just one thing that you don't want to say. I would hate to say to myself that I wish I had done this differently. I wish I have. So give it a full try, and if it doesn't work, it doesn't work. It's fine. It's okay.
We might need a part two. I'm grateful to you, Sandeep, for taking the time really to share this journey with us. And to those of you watching, thank you for joining us inside of this story, one that I know is still unfolding. If something resonated for you, if you're feeling the nudge of your own crossroads, I really hope that Sandeep's story makes you feel less alone. Healing is not something that we offer others, it is also something we learn to reclaim for ourselves. This is Unscripted, where truth finds its voice and physicians find their way back home to themselves. See you next time.